So that means the hamstring, this is the posterior part is the hamstring, and the anterior part is the quadriceps.
But it's a small
So,
one.
So you cover it like this. So the posterior part is the hamstring and the anterior one is the quadriceps. So literally whatever we have learned, the technique we are going to transfer. So for the exam, you master one, 2 or 3 techniques good for the exam. So for example, for the exam, we will be asking like in the question paper, you will take one paper, and in the question paper it will be mentioned percussion technique for the hamstring. So then you have to show proper skills, 2 to 3 techniques proper
Of percussion.
percussion of percussion, and other one is like muscle compression technique of calf. So
Oh,
then
it's
you
not
have
it's not specific. You don't have.
You can choose.
Yeah, we have the possibility to choose which technique we want.
Yeah.
Okay,
So
that's
you
good.
you have the possibility to choose. So 2 to 3 techniques, you master it yourself good. Good technique, standing position, positioning the patient. So main thing is you position the patient good and also inform the patient. Karen, I'm going to give the hamstring massage, muscle compression technique. Please let me know if you feel any sort of discomfort. So like this we start, and then you immediately don't look at my face, because during the exam I am not laughing. So I will be keeping quiet without any reaction in my face. So the main aim is that you should not look at my face. You are dealing with a real situation. So that is what you real patient, and you are not looking at my face. You just talk to your classmate and then start with the movement. Then only thing you have to do, Shibu, this is compression technique of the hamstring. So then you start, Karen, I'm going to start with the compression technique. So please let me know if you have any pain and discomfort. Then you start with compression technique. So after you finish the compression technique, Shibu, I'm going to start with just, you don't have to look at my face. Shibu, I'm going to start with the calf compression technique or skin rolling technique. Then you start the skin roll. Yeah.
Should we do effleurage in between the exam also after
Yes.
every
Yeah.
technique?
Yeah. So each technique just one time effleurage.
Do we have to explain like anything? Just showing.
Yeah,
Saying,
proper
I'm
skills.
gonna
I
do
already
this.
know. I already know if you do like mistakes with the technique. I already can see. So, for example, if you do for the compression technique, so if you are not catching hold of the muscle, and when you do this movement, you are going like this, then it is wrong, because you are not really catch hold of the muscle. So it is in the skin. So it is not good. So when you perform the muscle compression, you hold it, and then you perform, and then you stretch. So there is no movement like this. So that is wrong.
This was something we did last time, right? Nanda?
Yeah, of course.
And
So-
question: if we don't do the effleurage during between the techniques, do we get graded down?
No.
No. So why
I'm
do
not
it?
going to do that.
So why do it then?
If you want, I can do that. It's good in real life.
I mean, you have.
So
yeah.
it's
Good
so
for
when you practice according to this, then it will be more good for you to face the real patient and give the treatment, and the patient will be also more comfortable and relaxed. So, and also you drain the fluid out of the place and to get more healing, initiate healing process. That is what.
And we don't have to know each specific subcategory of the names?
No.
Just compression technique, so
Yes,
three,
in
okay.
general compression technique, yeah. So guys, we are going to move on to the hamstring, and how we are going to start. Initially the intermittent pressure, so that is the sequence you have to know. You have to start like this from here. You keep the hand like this, and then this hand is going to be like this, and then it should be a light pressure, holding it for 2 seconds, and then release. Again, light pressure, holding it for 2 seconds, and then release. Again, light pressure, holding it for 2 seconds, and then release. Again, we move up, so that like this. So this is initial contact with the patient and also the patient PT relationship. Like this, and then feeling okay, Karen? And then here again, light pressure, holding it for 2 seconds, and then release. Light pressure, holding it for 2 seconds, and release. And then we go like this, up, up, up.
I have a question. Are you palpating before you start doing this as well?
No, this is just in general palpation observation you have to do before you
Yeah.
start the assessment part.
Everything, okay.
Yeah. So the next one is the effleurage. Effleurage we are going to start from. So this is the popliteal fossa, and you have to know this is the medial side semitendinosus muscle, semimembranosus muscle is coming like this. You will learn later, and this muscle is coming like this, and it attaches here. So there is from the hip joint, so 2 joint muscle. So it attaches here. So always when we start the hamstring massage, so we also start from here. And also this muscle, this side muscle also comes and attaches here. So the first one, so I am going to keep my finger pad like this here. I stabilize my hand, and then I am going to go from here like this, and then it is going to be towards the groin region. So towards the inguinal region. So we are draining the fluid towards that lymph node. So here is the femoral triangle and also the lymph nodes which is coming there. So we give 3 times there massage, effleurage like this. So that is one. So we start from here, and the second one we go a little more towards the lateral side, and then I'm going to go from here, and then it's again going from here towards the groin region here. Towards here, and that is again for 3 times. I go here, and when you come here, you with the entire palm like this, you go and then do this, and then you move to the center. So this is the popliteal fossa, and from here you are going to go from here like this, and then again from here you change your direction towards the groin region. So then you are going to drain the fluid towards there. I'm going to drain. And another one, so you move, you change the hand, so like this. So from here, this is the place you start, and then you are going to go from here like this on the top, like this you go, and then you are going to drain the fluid towards the waist, towards the groin region. Again, so go like this, and then you are going to drain the fluid like this.
So you're following the spine, like the ridge,
Yeah,
whatever is
yeah.
around.
Yeah, the pelvis, pelvis and groin region. So that is one, and the last movement is from the here. We are going from here like this, and then we are going to go from here towards the groin region. So towards the groin region. Feeling okay, Karen? Yes. Yeah. So we have 1, then 2, then 3, 4, 5, 6 movement lengthwise. So this is the lengthwise effleurage, and the next one is the transverse wise effleurage. So you are not going to do this. So this is not correct. So this is not. So you are twisting or making pain for the patient. So you keep the palm like this, and then you keep it like this, and then do the movement slow and steady, like this movement. So this is the transverse effleurage. Transverse effleurage, transverse effleurage, transverse effleurage, transverse. And the next one is the depot-ing effleurage. So that is, you are going to keep it like this, the thumb and the fist like this, and you are giving massage like this. So again, for depot-ing, you are going to start from here, and then you stabilize with your hand here, and then you are going to perform towards the groin region. So 3 times. Feeling okay, Karen? 3 times. And then you move towards a little more this way, this 3 times, then again the center, go like this way, and again from here you stabilize, change your hand, and you go here. that is duping, and then the knuckling. So knuckling is like this, this way knuckling, and again you hold it like this, the same way you go here, 2 and 3 times, and then here again, here. Feeling okay, Karen?
Yes.
This way, and then center, you go like this, and then change the hand.
This is a type of effleurage, right?
Yeah.
Yeah.
So knuckling effleurage, other one is duping effleurage. So it is what you have to do. So when you come here, try to make sure that you are not giving that much of pressure. So then the patient, because it's near to the bone, so the patient can feel pain. So that is all about effleurage. So we did lengthwise effleurage, we did transverse wise effleurage, we did duping, we did knuckling, and the other one is the circular movement, circular effleurage. So you can do circular effleurage like this, circular effleurage. And the next one is the muscle compression technique. So muscle compression technique, there are 2 types, that is pressage and kneading. So that is the 2 types. So how we are going to perform? So that means if you cannot lift the hand, if you cannot lift the hamstring like this, then you can make the into 2 sides. So the right side and the left side. So like this you can make 2 parts.
Even
And
if your hand size too small.
too
and then
small
it's
also,
too
yeah,
big,
yeah, too small. So then if you always make sure this is from here, you are going to lift the muscle up, and then with your thumb you are going to grasp the muscle. So it has to be in between your thumb and the index finger, so like this, and then you stabilize with and lift up the muscle and make active movement, semicircular. This is the active stage, and then relax is the passive stage. So this, like this, this. Feeling okay, Karen?
What's
So
the
3
name of that
times.
one again?
This is muscle compression technique for kneading and pressure. So the next one is you move a little more towards back, and then if you want to give this side, so make sure you are going to the lateral side here, and then you are going to lift the muscle up, and then you are going to hold the muscle from here towards there. So then you are going to get the lateral side of the muscle, and then you are going to hold in this position, lift up, and then you are going to do semicircular and then relax. Active stage and passive stage, like this. Passive stage and active stage. So this one, and then you go on the top and then hold it, and then this. And then afterwards you can do effleurage. This one you go there. Effleurage. This is one muscle compression technique. Other muscle compression technique, that is again lifting up the muscle from here. You hold the muscle, and lift up the muscle, and you are going to do semicircular, and then you are going to do a stretch for 2 seconds. Stretch like this. Feeling okay, Karen? Stretch. So that is lift up the muscle, hold the muscle, and keep it like this in this position, and then semicircular movement, and then you do a stretch. So that is 2 seconds hold. Same thing, you lift up the muscle, you hold the muscle like this, and then from there you semicircular movement and then stretch. Feeling okay, Karen? Like this. So then afterwards that give effleurage, and you can also do, if you have big hands, you can also perform this. And with both hands, if you have big hands, then you can also perform this one.
Do
And
we have, like, this is the same like the side, but just
yeah, same like the side, but this is all together. I'm holding it all together, the muscle, lifting it up, and then I'm going to do the same technique which we learned in the calf muscle. So this one. And the other one is the circular movement or circular friction, the heel of the wrist. You have to practice with heel of the wrist, and then you are going to start with the movement. So how you are going to perform? So that means you are going to keep the muscle, you hold the muscle like this, you stabilize with the other hand like this, and then flexion, abduction, and also the heel, the pressure has to go from the heel of the wrist. From here, I'm going to hold it. Feeling okay, Karen? The pressure is okay?
Yeah.
Yeah, then I'm going to give a small circular movement on the muscle, I'm not going like this. This is not a muscle technique. I'm just feeling the muscle inside, and then I'm going to perform this movement. Feeling okay, Karen? Like this. And then 3 times, and then I'm going to feel the muscle, and then I'm going to perform the movement. Yeah? So this is the one. Yes, so these are the muscle compression technique now you will learn, and you will get practice session now, and next class I will finish with the skin compression technique, and you have to transfer also the same technique to the quadriceps, and then we start with the back massage for the next class.
On the exam, are we